living, playing, and working, and what that means both to what we heard about yesterday, but also what you're going to see and hear today. Um, I'd also like to draw your attention to an infographic that was created yesterday by Annalie Cornelson of Drawing Change, a blend of, let's say, a mind map and an infographic, which highlighted the key points that were raised by the panelists yesterday afternoon. We're really um, delighted to have Annalie do this work for us, and she's going to be creating a similar infographic for each session. You can access this infographic after today's session. There will be a link on the conference website right below the button for each session. So you go into the session, and there'll be a link that will take you to the infographic for that session. So without further ado, I'd like to hand the first session of today over to Irana. Irana?
Thank you, Peter, and happy Wednesday, everybody. Good morning, where you are. Good afternoon, where you are, and welcome to the session on refocusing, giving, and prioritizing community needs. My name is Irina Hovrenkov, and I'm an associate professor with the Johnson Trioma Graduate School of Public Policy here at the University of Regina. My colleague and co-host, Dr. Lynn Gidluck, leads the University of Regina's Community Engagement and Research Center, and we're both delighted to welcome you to this session and thank you for sharing your time with us today. Peter has mentioned that we're located everywhere on a treaty territory, and I would like to acknowledge that the land we gather on, the land that I gather on with you today, is Treaty 4 territory, the traditional territory of the Cree, Saulteaux, Assiniboine, and Métis. And as many of you are joining us from across Canada, I kindly invite you to acknowledge the land of your location. Today, I have the honor of introducing you to 4 amazing speakers who have kindly agreed to share their time, insights, contributions on partnership, community engagement, grant making, all through the lens of community needs and community well-being. I have Miriam Berube, Consulting Director for the Quebec region from Tamarack Institute, Tracy Mann, an Executive Director from Community Initiatives Fund in Saskatchewan, Dr. Andrew Stevens, an Associate Professor at the University of Regina and a counselor with the City of Regina, and Dr. Emily Grafton, who is a member of the Métis Nation and an Associate Professor at the University of Regina. I want to extend a warm welcome to our panelists for joining us today. The way we planned this session is that the next hour will be devoted to presentations where each panelist will have about 15 minutes to share their thoughts with us. And then the remaining hour will open for the floor for questions. We'd like to make this session as interactive as possible, recognizing that we have a bilingual audience. And for that, we ask you to share your questions and comments in the chat box. We will then pose the questions to the speakers on your behalf. We have both English and French speaking moderators today who will be monitoring the chat for questions, so you're welcome to ask your questions in English or in French. And when you're asking a question, if you could kindly identify the organization that you're representing, that would be wonderful. And then following the question and answer session, we will be delighted to share with you a musical piece by a talented Saskatchewan musician, Megan Nash. So with no further ado, I'd like to welcome Miriam Berube to the virtual floor. Miriam is the Consulting Director for Quebec at Tamarack Institute. She's passionate about community innovation and development. She contributes her prior experience in philanthropy to changemakers aiming to support collective impact, capacity building, and transformative community change. She currently is the lead on the participatory grant-making project in partnership with the WES Miriam Asafa Fund. Miriam, welcome to our session, and the floor is yours.
Thank you so much, Irina and Lynn, for organizing this session and for including me in the Western Hub. I'm calling in from the traditional territory of the Ghanaian Gehaga people. Jojage, or Montreal, is historically known as a place of gathering for many First Nations. But today, I'm glad to be part of the Western Hub. Thank you to Peter and Jean-Marc as well for gathering us in this important event at this first Philab National Conference. So I will be sharing my screen in a moment with a short presentation. I think you can all see my screen now, is that right? Wonderful. So Tamrock is a connected force for community change. For 20 years, our learning center has supported community leaders, organizations, municipalities, funders, and citizens to develop their skills, knowledge, resources, and networks for impactful community change. As you can see on the slide, we are supporting our learners through 5 interconnected areas of practice: collaborative leadership, community innovation, evaluating impact, collective impact, and most importantly for today's session, community engagement. That will be the focus of our conversation today. We also support a large network of vibrant communities to implement large-scale change initiatives to reduce poverty and deepen community. And more recently, during the pandemic, we have launched 2 new networks. One is to build youth futures, to help youth navigating education and employment in uncertain times. And the second one is about the climate transition to support a just and equitable climate transition. Why we work at the community scale at Tamrock? For many reasons. As you can see, we find it easier to rebuild and strengthen connections, trust, and relationships between diverse people who live in the same geographic area. Community-wide efforts offer immediate and meaningful opportunities for leadership by persons with lived experience and inclusive approaches. We also find that there's a greater chance of addressing integrated economic, social, and environmental issues in practical ways at the scale of community, that people are typically more willing to commit to long-term efforts to make change when it is their community. And finally, place-based efforts allow for greater flexibility, innovation, and responses that fit the unique nature of distinct communities. Why is this important to today's conversation? Because it is the lens that we use, at least at Tamrock, when we talk about community needs and community assets. One of the questions that was asked by Irina and Lynn when they invited me to join this panel was to give an overview of some of the main issues that have been identified by our network of vibrant communities in the last 2 years during the pandemic. So what you can see are some of the priority domains in response to the COVID-19 crisis. But just to rewind back a little bit, when the World Health Organization declared COVID-19 a pandemic in March 2020, the Tamrock Institute had been celebrating Canada achieving the lowest rate of poverty in the country's history. A month earlier, Employment and Social Development Canada released results that showed that since 2015, more than 1 million Canadians had been lifted out of poverty. And instead, what we saw in 2020 and 2021 reversed many of the successes around poverty and inequality that were made in the last several years. We can say that the pandemic has tested the foundations of the Communities Ending Poverty Network. I did not mention that, but it is comprised, just to give you an idea of scale, of 330 municipalities represented by 90 community roundtables all across the country. And we have learned that to end poverty takes the whole community working together. So what our members do is that they ensure that everyone, all the sectors are brought to the table, including people with lived or living experience of poverty. And they build on the assets of the communities to drive long-term change to develop and implement plans to reduce poverty locally. So during the pandemic, many were able to draw on the collaborative practices and the partnerships to shift their work to poverty mitigation and to provide immediate support to the most vulnerable people. Just very quickly, as you all know, nonprofits played an essential role in answering the basic needs through outreach activities in all the priority domains that you see on the slide. And also through virtual activities, they ensure that isolated people remain socially connected. And this has been an enormous value added of the community sector during the pandemic. Just to provide a few concrete examples, our vibrant community network supported low-income residents and helped them gain access to essential services, such as transportation to groceries and medical appointments, bringing primary healthcare into low-income neighborhoods to get people vaccines, helping seniors stay at home by organizing a phone-based wellness check each day, or adapting school nutrition programs to deliver groceries during lockdown. Just to name a few examples. There are many amazing stories of responsiveness and resilience during the crisis. What was particular about the Vibrant Community Network is that because they are multi-sectoral tables, they were able to provide a coordinated emergency response and coordinate also the service delivery and information sharing, and also engaging in advocacy. There are two new priority domains that emerged during the crisis. The first one was diversity, equity, and inclusion. And as you know, we have seen inequality being exacerbated during the crisis. And despite that recurring mantra that we heard all along the COVID-19 pandemic, that we are all in this together, clearly visible minorities were overrepresented in COVID-19 cases. And long-term systemic marginalization, systemic racism became striking. With respect to many, I think for the overall society, with respect to Black, Indigenous communities and other racialized groups. So for our network, it became urgent to apply a diversity, equity, and inclusion lens to all the work that they were doing. And the second one is quite obvious, is the access to technology. As we all know, the community sector was totally unprepared to face the technological challenges, and also help vulnerable people bridge the digital gap during the pandemic. Based on the current stories that we hear from our communities, we see that income, housing, and food insecurity have risen. We hear a decrease in physical, mental, and emotional well-being, especially due to prolonged social isolation and stress, and even developmental losses for toddlers 6 years and under. So for Tamarack, it has been very important throughout the crisis to purposely connect communities together, share stories of community response and resilience. But 2 years is a long time to navigate the crisis. There is fatigue. At the same time, the climate crisis is also overwhelming us, and now our attention is focused on war and the Ukrainian refugee crisis. So all these intersecting challenges often drive us towards simple solutions, such as, okay, let's reopen our workplace, let's return to delivering services as usual. So Tamarack is trying to support communities to learn from the crisis, adapt, and build towards a more just and equitable recovery. These are some of the emerging, or we could say ongoing needs, unmet needs that we see right now. The first one is to take care of the caretaker. They are exhausted in the health and social service sector. There's a lot of turnover with fewer people coming in to take the jobs. There's also a need to enhance communication with governments, back and forth with community, to be able to quickly inform elected officials of the gaps and needs in communities. There's a need to create community resiliency strategies, and that includes things such as collaboration, increasing learning and sharing across communities to share successful service adaptations, learn from the crisis, and anticipate upcoming needs. Also work towards emergency preparedness. Even though we went through a crisis, we have many signals that we might not be prepared for the next one. Some of the ongoing challenges need to be addressed as well in the community in terms of income, food, and housing security. Still need to bridge the digital divide. I'd like to raise your attention to a great initiative that has just been launched a few weeks ago, the first of the sort. It's the Canadian Centre for Nonprofit Digital Resilience. Tamrak is a co-founder of that initiative that focuses on the digital capacity building for the nonprofit sector. And the last one is changing the funding field. During the COVID emergency, there were dollars that were provided that were well needed to support nonprofits to hire staff, to collect data, to make building improvements, to run important programs, services, and so on. But this funding is not sustainable, and the funding pot is stopping now, so no one knows what will happen next. Looking at some of the common thread in what I have presented so far. The COVID-19 pandemic uncovered a lot of inequities in our systems. We say the pandemic, but I just want to mention that it's not only the pandemic. There were other concurring trends, such as the Black Lives Matter movement, the Truth and Reconciliation in Canada, that also uncovered past and present far-ranging inequities in our systems and society. Philanthropy was also challenged, both in the way of who it served and how the funds were allocated. We saw emerging voices from Black communities showing that they were underfunded as compared to other groups, and also some of the ways the funds were allocated that became a lot more flexible during COVID also showed that that some of the habitual processes were not that transparent or democratic. So the underlying power dynamics were also being challenged. So that brings me to those 3 points to refocus giving. The first one is about equity and voice, to engage people that have been excluded, or marginalized, to support collaborative strategies to engage citizens and institutions working together to solve major community issues. At Tamrak, we really see this as a promising path to recovery and resilience. And finally, changing the power dynamics, to give agency to people from the communities and to share or even to cede decision-making powers and so on. To illustrate those 3 points to refocus giving, I would like to share now a very concrete example of the participatory grant-making pilot in the Peel community that the Tamrak Institute is undertaking with the West Mariam Assefa Fund. So the West Mariam Assefa Fund is the philanthropic arm of the World Education Services. They are based in the US, but now expanding their philanthropic action into Canada. And for them, there were 3 main reasons why they decided to get involved in participatory grant making. Well, the first one was to inform the fund's evolving approach, to shift power to communities, and also to build a movement with other funders as they learned from this first experiment. The only parameter that we had was that this participatory grant-making pilot was to focus on the needs of immigrants and refugees and fund community-selected projects that help to remove economic barriers and to build equitable economies for immigrants and refugees. That's it. That was the only parameter of this project. So for Tamrak, as you've seen, we are not a funder. So why did we decide to embark on this initiative? Well, it was mostly that we saw it as an opportunity to bring forward our know-how and experience in community engagement. For us at Tamarack, there are two types of expertise. The content experts. These are the professionals, the staff in our organizations, the service providers, the leaders that have formal power to and that have the knowledge, the tools, the resources to address the issues, while the context experts are the people with lived experience of the situation. And in our experience, they are often the ones that know best how to address systemic barriers because they've been facing them personally. And they are in the best place to find the most adapted solutions to that context. So this whole experiment of participatory grant making was about centering lived experience. I will move a bit quicker. I know my time is almost up, so I will go quickly. You can see here what is participatory grant making. It's basically a process to shift power, control, and voice to communities. So instead of having the foundation staff making decisions over funding, they cede that decision-making power to community members. Very quickly, our process. Last week, we just announced that 6 community projects were being funded in the Peel community, and I'm starting by the end here. But that was very exciting. I guess I want to start there because I want to show that it's possible to come to concrete results in a relatively short amount of time. That was about a 6-month process. And that it might not be as risky as it might seem to embark on participatory grant making for some funders. So our process, once we've selected the community, the Peel community near Toronto in Ontario, we started recruiting and engaging a people's panel that was made of 12 community members. And this panel was formed to co-design a funding opportunity. The panel included immigrants, refugees with lived experience, but also leaders from the immigrant serving sector. And they reflected on both their knowledge and lived experience to identify the priorities and the needs of the Peel community. So we had 5 co-design sessions and 2 grant-making sessions to come to that final results of funding 6 community projects. And this is my last slide. Just want to share with you some of the lessons that we learned on refocusing giving and prioritizing community needs. What you see on the left-hand side is the panel application guidelines that was designed by the People's Panel. And what we learned from that process is that multiple perspectives grounded in lived experience helped us avoid some blind spots. And just to give you a few examples, we are focusing here on building equitable economies for immigrants and refugees, so employment-focused efforts, right? But instead of just engaging industry or building the skills of immigrants, the panel focused on identifying the gaps in the system for marginalized immigrants and refugees. They brought forward a holistic approach. For example, the importance of embedding mental health supports into all employment services. They focused on including some invisible vulnerable groups, such as the international students that are vulnerable to exploitation in the housing and the labor market, for example. And they put a great emphasis on collaboration and community accountability. I come from a funder's background, and I don't think we would have come to some of those same specific results if we had followed a conventional allocation process. One of the learning was also that there is capacity building for all stakeholders involved. We often talk about the People's Panel. Of course, they build their capacity through this grant-making process, but Tamarack is also building its own capacity. West, the Mariam Assefa Fund is building their own capacity, and also other community and organizations in the Peel community through this project. We through the process of listening, we were able to shift the narrative in empowering people so that they could tell the story of the PL community, emphasize what were the immediate needs of the immigrants and refugees in the PL community, and be able to act upon those issues through this concrete mean that the fund gave them through the Building Equitable Economies funding opportunity. And finally, one of the key learning was to build trust among each other. That was a very important part of the process, but also in the process itself, that we have to trust the collective process and the collective intelligence through a thoughtful facilitation process, but that we will come at the end to a result that is a lot more grounded in the specificity and the uniqueness of the PL community. If you want to learn more, I put some information here. And I will stop sharing my screen. So I'm sorry, Irina, I went a little bit over time.
That's great. That's great. Thank you, Miriam, so much for your presentation, for your contribution, for emphasizing the importance of community in grant making and in other areas, but also stressing what the needs are. I think it's important that we are reminded what the needs are. Now we have to come up with solutions and how we address those needs, but talking about them, I think, is important. So thank you for your contribution this morning, Miriam. I'd like to pass the torch to a good colleague of mine, Tracy Mann, who's an executive director with the Community Initiatives Fund in Regina. Tracy brings more than 30 years of experience working with nonprofit organizations to address well-being, and also leads high-profile initiatives such as the SESC Wellbeing and Saskatchewan Nonprofit Partnership. Tracy, welcome to today, and thank you for your time.
Thank you, Irina, and good morning, good afternoon. I would like to humbly acknowledge that I live and work on Treaty 4 lands, but also acknowledge that our organization's work and support reaches lands covered by Treaties 4, 5, 6, 8, and 10, the traditional lands of many First Nations peoples, as well as the traditional homeland of the Métis. So the Community Initiatives Fund is a special purpose fund established by the Government of Saskatchewan in 1996 to receive and distribute a portion of net profits generated by Casinos Regina and Moose Jaw. Our mandate is to strengthen communities and enhance quality of life for Saskatchewan residents. We operate at arm's length from government and are governed by an appointed board of directors. The revenues that we receive are distributed as grants to support community-based programming throughout Saskatchewan. And while we are not technically a philanthropic organization, we do operate much like a foundation in terms of our granting programs. On average, other than the past 2 years, we provide grants totaling $7 to $8 million to support about 550 programs each year that benefit approximately 20% of the province's population. During our 26-year history, we have granted more than $180 million to over 12,000 programs in 510 communities throughout Saskatchewan. Our grants are provided under 3 funding themes: healthy growth and development of children and youth, individual and community well-being, and nonprofit and community leadership. Each of these funding themes is associated with 4 to 6 outcome statements that further define our funding objectives. We support an extremely diverse range of programs, with those related to the children and youth theme representing more than half of all programs falling within the well-being theme a bit less than half, and the nonprofit leadership theme represents approximately 10% of programs supported. Due to the nature of our organizational structure, our grants are provided as program or project-based grants rather than as core or unrestricted funding. We are one of only a very few funding organizations in the province that has specifically identified support for nonprofit capacity building as the explicit funding priority. And while CIF does not provide unrestricted funding, our grant recipients under any of the three themes are able to claim up to 20% of their total grant amount as operating expenses, for which no documentation is required when providing their final reports. The CIF board implemented this option several years ago, recognizing that for nonprofits to be able to effectively deliver their programs and services, they must have the capacity and infrastructure in place to be able to do so. To ensure that our funding themes are relevant and responsive to community needs, we are continually monitoring applications and reports, consulting with community partners, reviewing current research, and observing what is emerging at both the community and provincial level. So as a funder, we can gather and analyze data on the programs that we have funded and understand the benefits to program participants related to the funding themes and their associated outcome statements. But that data doesn't provide an answer to the questions of how has the capacity of communities and the quality of life of people in Saskatchewan been enhanced? Has quality of life generally increased or decreased? Where has progress not been made? What are needs that are still unmet? In 2015, CIF partnered with Heritage Saskatchewan, another provincial organization whose mandate is to improve quality of life through celebrating living heritage. Individually, Ingrid, who is the CEO of Heritage Saskatchewan, and I had both been following the work of the Canadian Index of Wellbeing for many years. And when we discovered our mutual interest, we engaged the CIW to develop a report for Saskatchewan. The Canadian Index, developed with the input of Canadians across the country, is a framework comprised of 8 domains of well-being, each with 8 indicators, so 64 indicators in total. Recognizing that people's perception of their quality of life is based on factors much broader than the traditional measure of only GDP, the index tells a more comprehensive story of well-being that includes but expands upon economic measures. The most recent report tracks data over 21 years and presents a rich story of how well-being has trended and changed in response to events such as the economic recession of 2008. In October 2019, we released the first Saskatchewan Index of Wellbeing report, utilizing the CIW framework and Saskatchewan data covering the period 1994 to 2014. In Saskatchewan, our GDP over this period of time increased 44.1% compared to Canada's growth of 38.0%. More telling, however, is the growth in Saskatchewan and well-being, which increased by only 13.2%, representing a gap of almost 40% between GDP growth and well-being growth. And this gap is greater than the overall Canada gap of 28.5%. The report demonstrates very clearly that a focus on economic growth alone does not translate into a similar growth in people's sense of well-being, and in some cases has actually resulted in a decrease. While the composite index demonstrates how overall well-being has trended, we have to look a little deeper into each of the 8 domains to better understand where progress has been made or not made. In Saskatchewan, there have been very positive advances in the domains of education and living standards, while there has been a significant decline in leisure and culture. We can unpack this even further by looking at each of the indicators associated with each domain to really understand where there is further work to do. So for example, when we look at the education domain, even though the domain overall saw significant progress, we can see that the average amount of time, for example, spent in talk-based activities with children aged 0 to 14 years declined significantly. And within leisure and culture, all indicators, with the exception of one, declined over the 21-year period of the report. This data encourages us to have conversations across all sectors to further explore the factors that are leading to progress in areas and why progress in other areas may not be occurring, and what strategies could be implemented to enable greater progress. Since the release of the Saskatchewan report, we have continued our partnership under the umbrella of Sask Wellbeing, and the website is saskwellbeing.ca, promoting the adoption of a well-being lens in community planning, policy development, and allocation of resources. We have also shifted our focus from promoting only the index as a framework to include other well-being movements and frameworks that are being adopted and implemented globally. Examples include the Wellbeing Budget introduced in New Zealand, with other countries such as Scotland, Iceland, and Germany adopting similar frameworks. Here in Canada, the federal government has adopted a plan to work towards the 17 UN Sustainable Development Goals, but more recently introduced a quality of life framework with Budget 2021, which will serve to inform and guide evidence-based decision-making in policy and budget planning. Other provinces, territories, municipalities, and regions in Canada are also adopting frameworks that reflect the priorities of their respective citizens. If there has been a silver lining to the past 2 years, it has heightened our awareness and appreciation for what brings meaning to our lives and what provides us with a sense of well-being. However, it has also exacerbated pre-existing social issues such as mental health, long-term care, racism, domestic violence, systemic marginalization, gaps in services, and disconnection from community. Now we have an opportunity to rethink how services are made available and how people have access to those services, as well as looking at funding models. As we know, many funders were very flexible and responsive in the early days of the pandemic, but it seems that they are now reverting in many cases back to traditional funding models. Regardless of the framework utilized going forward, there are some shifts that must happen, from political decision-making to evidence-based decision-making, from reactive responses to issues and challenges to an upstream, proactive, preventative approach, from working in silos to multi-sectoral, collaborative approaches, from short-term to long-term planning, and from funding relationships to partnership relationships, particularly when working with government partners. As Miriam mentioned, nonprofits were very much at the forefront of responding to the pandemic in its early days, and they have continued to adapt and modify their programming to ensure that community needs are being met. We also know that nonprofits are often the first on the scene in the cases of emergency or disaster response. And I'll use the Humboldt crash as an example, where nonprofits were on the ground in that community within an hour of the news of the crash happening, whereas other supports coming from other levels of the public sector weren't there for approximately 12 hours. Just goes to demonstrate how critical nonprofits are in communities in all kinds of situations. The sector is absolutely critical in contributing to quality of life and well-being of people and communities, and needs to be recognized and valued as an equal partner. A recent article in the Philanthropist Journal articulated in a clear and concise way how the sector is uniquely positioned to provide leadership and long-term planning that leads to equitable, inclusive, and resilient community growth. This requires not only that the sector be included in designing policies and strategies to address social issues, but that nonprofits are provided with unrestricted funding that supports the real costs and infrastructure required to do the work in communities that neither the public nor private sectors are able to do. I'll end there and look forward to questions and discussion later. Thank you.
Thank you so much, Tracy. Thank you for your engaging presentation and for all the important work that your organization is doing in promoting well-being. I'm certainly a big fan of this concept and for seeing it move along, because it touches on so many aspects that we're discussing today. Not just the economic GDP, we're doing so great financially, but all those important pieces that are crucial to our, the quality of life, our well-being. Thank you for your contribution. I'm delighted to present our next speaker, and that is Dr. Andrew Stevens. Andrew is the counselor with the City of Regina, but also is an associate professor with the Faculty of Business Administration at the University of Regina. Andrew teaches and researches in the areas of labor relations, collective bargaining, and political economy. But we've asked Andrew today to speak on his role as the counselor, certainly bringing his expertise as a researcher as well. So welcome, Andrew, to today's session, and thank you for your time.
Thank you very much for the invitation to speak. I'm going to keep my presentation very short. I don't want to go over much of the terrain that's already been discussed, other than to say I think we're in alignment, and I've been frantically taking notes about the community participatory grant-making process. I find that incredibly important. I'd like to perhaps replicate some of these suggestions at the City of Regina, because I think we do need a different approach to dealing with these important socioeconomic concerns, and the status quo isn't working. If I were to craft a title for what I'm going to present, it would be Anti-Philanthropy and why we should think more about the importance of public services and mutual aid. I'm coming at this topic as the city councillor that represents some of the most challenged socioeconomic communities in the City of Regina. And I say challenged from housing insecurity standpoint, food insecurity, income insecurity, racism, discrimination. And so I'm kind of front and center in the city when it comes to the value of mutual aid and seeing the importance of community participation in building solutions, but also the shortcomings of existing public service delivery models. I think I'm at a bit of an advantage as a sociologist that studies questions around just transition, living wages, migrant labor, and collective action, and kind of understanding the actual mechanisms that generate these disparities in the community. I guess my general position and argument here is that COVID really did expose the consequences of underfunding of public health care and our pandemic preparedness system. I think that became very clear. People responded, however, with mutual aid, and governments at all levels invested record amounts into services and supports that were required to keep people alive. And I think in many respects for a time, and I worry that we're kind of coming out of this period, governments realized that, hey, we're important. Philanthropy by itself, in terms of wealthy people and agencies giving, is not enough. And it really put the brakes on a right-wing populist movement that was building in Western Canada and Ontario. And all of a sudden, that rhetoric didn't work anymore when you actually had to be a meaningful public figure and leader and use the agencies of government to deal with an important crisis. Along the way, we also saw the importance of partnerships between government agencies and community-based organizations, which we've already talked about so far, that responded on the ground to the immediate needs of society's most vulnerable. And I think if there's something we need to think about, and if we need to reimagine philanthropy, it's that this kind of giving is a symptom of a broader set of problems, like the inadequate support for public services, sustainable funding models for community-based organizations, and philanthropy by itself is not a solution. And I guess I should be clear here, I'm not talking about community-based organizations that we've seen showcased today, but rather these high-profile corporate and wealthy individuals who give in the flashiest of ways, talking about the splendor of wealthy giving as a solution to some serious crises in society. And I think it really is a distraction. So when I'm thinking of philanthropy, that's kind of how I'm situating it. And I don't want to be mistaken as someone who's casting aside community-based organizations that are doing incredible work. And this one's a bit of a challenging statement for me to make, because I'm technically in the world of government. It's the low level of government. We don't have a lot of money, a lot of power. But I think we're at a point where we really need to look at the limits of how we've understood the delivery of public services. And so if I'm thinking about the value of going back to recognizing the important role of the state in intervening in society and dealing with social determinants of health and other social issues, it doesn't mean business as usual. And I think as a point of policy, it means drawing from community expertise and delivery models, which succeed in ways that often conventional public services don't. And as an example, it might mean empowering Indigenous community-based organizations that have done incredible work in Regina, especially in the most disadvantaged communities, with minimal funding. And it's just a response to, well, the public services aren't delivering as they should. We're just going to do that work. It also means reflecting on a trend in policy building at the civic level around community well-being, actually using that terminology and approaching socioeconomic realities from a different vantage point, which historically might have been responded to with more policing and a reactionary approach to, say, homelessness and addictions. And what this approach does as a matter of policy, again, is actually connecting community-based organizations with provincial agencies and city services and staff. So I think the way forward is really a matter of rethinking the delivery and involving the community and members of the community as individuals in new ways. And this is a matter of empowerment. I would argue that reconciliation itself as a policy doctrine demands this kind of collaboration. It cannot be a top-down approach. And as an example, it does demand a different configuration of aligning public service delivery, public funds with the community. There are other examples like cold weather strategies that get people out of the cold and prevent unnecessary deaths for homeless individuals in our community with community-based organizations and public support. I think another approach, as has been discussed so far, if we're thinking about not just business as usual, the community investment grants that we use to help fund community organizations, we need long-term sustainable funding models. And the reason I say that is you shouldn't have to devote a significant amount of resources as a very streamlined community-based organization to constantly apply for funds and be accountable in ways that even the public sector is not accountable to itself. In addition to the fact that these pots of money have not kept up with just basic standards like cost inflation and the need in the community. So the way we deal with grants and funding organizations desperately needs to change. And part of it actually is a reflection on elected officials who I often joke will spend hours debating how we spend $25,000, but will write checks quite easily for hundreds of thousands, if not millions of dollars to large organizations because we just take for granted their claims and their impact in the community. So I think this is an approach that we need to think about in terms of not business as usual, but still recognizing the importance of public agencies and public services. And now the mutual aids component, I think this is really what kept a lot of people alive, what tended to addictions, what tended to mental health issues in the community was a voluntary exchange of resources, in some cases reciprocated. But elders in our community had food brought to them by community organizations that emerged spontaneously as a result of the pandemic. People were fed, not just through food banks and other established organizations, but also through agencies of mutual aid that emerged very quickly in response. We also saw mutual aid in the practice of developing small-scale production of PPE, namely masks, when they were not available initially in the pandemic. Other issues were tended to, like food security, through community gardening, which some laughed at this in the city of Regina, but it also meant a way of bringing people together, which is really important, safely outdoors. Mutual aid played a huge role in this. There were wellness checks where those established institutional responses did not already exist. There was moral support for public healthcare workers. There was stepping in where public services failed or were very sluggish in their response. We also saw mutual aid pop up in terms of finding out ways of still engaging in physical activity and recreation and entertainment and art and culture, which is really important. We certainly should think about the fundamental needs of individuals in terms of food, safety, and so on, But there's also an emotional well-being that has to be serviced, and people tended to this, in addition to public services that offered those kind of spaces. Like many other urban centers in Canada, Regina is overwhelmed with addictions. And I would argue that those issues and that crisis was amplified by COVID for a variety of reasons. So the escalation of that problem meant that you needed to take harm reduction seriously, and the city responded by creating a new harm reduction stream of funding, a minor amount. It was a bit of a struggle, but ultimately that money was used to think about what harm reduction means, and it's not just about safe consumption, needle exchanges, and so on. But that also meant putting money in the pockets of organizations, community-based organizations that were doing on-the-ground work, streamlined financially, very minimal staff, but it kept the lights on, and it started talking about a new way of municipal government engaging with these kind of issues when the province has long taken over the public health responsibility. There was examples such as the Owasso Warming Center, which was a drop-in center where you could go without any questions asked. And a lot of drop-in centers won't allow you to be high or drunk. To some degree, no questions were asked, so long as you were not violent or aggressive to anybody. If you needed food, if you just needed a table on which to rest your head for an hour or two, you needed to go to the washroom, you needed a warm drink, just somewhere not to freeze to death, this organization just popped up. And it was something that was financed in part by the YWCA and the city of Regina. Minimal funding, completely neglected by the provincial government. It saved lives. And I don't think that should be overstated. And while it isn't a systemic, it doesn't get to the systemic issues in the community, again, people were kept alive that would have otherwise died on the streets had this organization not emerged. We also saw partnerships with public agencies and community-based organizations to deal with housing insecurity in response to a place called Camp Hope, which popped up in an intercity park. And it was a response to the inadequate income supports that were being delivered by the provincial government, which actually rendered people homeless almost as a matter of public policy. The camp emerged as both, I would argue, a protest, but also a recognition that, well, these people are living in alleys, they're living in burnt out houses. They then gathered individuals and created a safe space in a public park where people could get food, temporary shelter before it got cold, and tents. It was donations that kept this place afloat, as well as incredible amount of time and effort invested by volunteers. And the city actually provided some support by way of a bus as a warming shelter. Fire and protective services were there to create a barrier against the wind and to ensure that the fires that were being lit were safe and people didn't die as a result of exposure, carbon monoxide, and so on. So there, again, an integration of municipal services and agencies with the question of and the exercise of mutual aid. If we go back to the effects of meaningful policy interventions, CERB and other income support systems were huge levelers. They prevented massive amounts of personal bankruptcy, destitution when the lockouts were advanced, people in food services, retail, etc., made living wages for the first time because of CERB. And while we certainly saw the growth of inequalities and poverty, I think CERB was a great leveler in many respects, and it did stave off bankruptcy and financial immiseration. We also know that it certainly advantaged the most marginalized workers and people in the community. Indigenous folks were more likely to receive it. Racialized workers and others were more likely to receive this than white folks in the community. Like it had a huge effect. And this is an incredible example of how a basic income program could work. And it did demonstrate that being paid through CERB had an economic advantage because of the deplorable wages that often define those industries that are most hard hit by the pandemic. I think also important, it did, again, where I started, it did put in question the neoliberal model of let's claw back the role of the state, let's minimize public funding, Let's decentralize the kind of approach that we take to the delivery of public services. That was put on hold because of the recognition that the public sector is significant, and at the same time that community-based organizations do have a place in delivering those services. So I think if there was a benefit here, is that COVID really did cripple the notion that we can untax ourselves to prosperity and really undermine the role of governments. I think what also was exposed here, and I think goes back to my definition of philanthropy as really being the exercise of the wealthy. We went from we're in this together to recognizing that corporate profits actually soared in many industries. And those companies also benefited from wage subsidies and short-term top-ups. And so I think we're going to see an emergence of the new philanthropy coming in parallel with demands that the government stop spending on social programs and public supports. And so I think we're coming to a very interesting political intersection that we need to pay attention to. And we'll go back to this model. Well, if I just write a check and promote myself as a corporation like Loblaws or Sobeys or TC Energy, that's how we do good. And we'll just demonstrate our value to society, ignoring the fact that we've demanded lower taxes, and we want to see a clawback of public support. So we do have to be weary right now, I think, about the effects of inflation and the return to austerity and debt fighting. And I'll leave it at that. So I think there's a political context here we need to be aware of, but going back to the basics, that public sector investments are significant, and we also need to see a kind of a renewed approach to working on the delivery of those services with and through community-based organizations. I'll leave it at that.
Thank you, Andrew. I really appreciate how you have highlighted this key role that municipal government plays. And I teach public finance in my day job. And the first thing that I tell the students is we start with actually talking about municipal government, and that it is the level of government closest to people. So I highlight the importance of it in my classes, and I really want people to take away this notion that, you guys do such important work and partner with all these organizations, and I just have been enlightened. So thank you so much for highlighting that. I think the value of that is going to carry us into an interesting discussion. Thank you. I'd like to pass the virtual torch to Dr. Emily Grafton. Emily is an associate professor of politics and international studies at the University of Regina. And also, Emily is a member of the Métis Nation and has spent considerable time working with Indigenous communities during her time as a researcher, as an academic, as a government and non-governmental engagement. And I would like to welcome Emily to this session. Thank you for being here today. Thank you for closing us on all the presentations today. And I look forward to the discussions that are going to follow after your presentation.
Well, thank you, Irina, and thank you, Irina and Lynn, for inviting me to be on this panel, and thank you to the panelists. It's an honor to sort of, as Irina says, wrap up these presentations and to sit and share this space, this virtual space with everyone today. I was asked to speak on this panel to talk about some of those experiences that Indigenous peoples have had while navigating the pandemic. So the title of my talk is What the Pandemic Has Taught Me About Reconciliation, Indigenous Peoples and Colonial Resistance During the COVID-19 Pandemic. As Irina mentioned, I am a Métis I am a member or a citizen of the Métis Nation, but more importantly, I think, to this panel is that I'm a scholar of settler colonialism and political inequities in Canada. I also sit on two different adjudication committees for the City of Regina that deal with social spending and harm reduction, so some of those things that Andrew was talking about. And as Irina mentioned, I'm a community-based researcher, so I do a lot of research with Indigenous communities here in Regina. So all of that in consideration, I do want to share my specific vantage point into the pandemic and, with more generality, those experiences of Indigenous communities concerning the pandemic. I'm sure it will not surprise you that in my home province of Manitoba, Indigenous peoples make up 10% of the population, but accounted for over 70% of COVID cases. And across all of North America, Indigenous peoples have died from this disease at roughly double the rate than those non-Indigenous demographics. Interestingly, these kinds of disproportionate outcomes are reported as comparable to that of the 1918 influenza pandemic and the tuberculosis pandemic. These realities are a result of colonial legacies that foster disproportionate health outcomes. So today, I want to talk a little about these results of colonialism, but more importantly, I want to talk about the resilience that I see amongst community-based responses to the pandemic. I think that there are some lessons that we can extrapolate from responses to this pandemic that can perhaps inform broader reconciliation efforts. And hopefully this is of use to some of you in the audience who may be working on reconciliation. So before I discuss Indigenous peoples' COVID experiences and effective responses towards reconciliation, I want to share a little bit about my personal experience as a framework for this talk. When I think about how the pandemic impacted me as a citizen of the Métis Nation and an urban Indigenous person, I think about this in terms of three spheres of Indigenous identity. First, relational responsibility and kinship. Second, cultural identity. And third, material need. What these three things have in common is an interrelated foundation of resilience. In many ways, what I want to talk about today is the ways that Indigenous peoples experiences in resisting and overcoming colonialism, including assimilation and genocide, have equipped Indigenous communities with tools to overcome obstacles due to the pandemic. So let's start with relational responsibility and kinship. Now, I personally haven't been home or on my traditional territory through this whole pandemic. I have a trip planned in a couple of months. But, I've had family members die and I've lost old ones back home. I haven't been on my land. Now, lots of people have certainly gone through this, Indigenous or not, right? We've all faced social isolation and distance from our loved ones. But what I want to share with you is the ways that this impacts my kinship circles and practices of relationality with my Métis family, those Indigenous communities here in Regina, and my nation back home. It alters my relational identity. The second is cultural identity. So I haven't physically been to ceremony through this whole pandemic. I've done Zoom ceremony and those kinds of things. But this has been really hard on both me and my husband, who's also Métis. Ceremonies are absolutely key to our cultural identity and our connections to both our ancestors and our present-day communities. Now, this was really driven home for me a couple of months ago by my son. The pandemic closed most things down soon after his 3rd birthday, and he has just recently turned 5. While we share cultural teachings at home and we do go to socially distanced cultural events, in his short life in the before world, before the pandemic, he knew ceremony intimately. He was, to my surprise, able to sing along at his first pipe ceremony. And this is no small feat for a youngster on the deaf and hard of hearing spectrum. During this past winter, he asked me where the songs went. He hummed a beat from lived memory or ancestral learning, I can't say, but it stood out to me as such a pivotal moment that he could identify as a youngster that he was deeply missing something so important to his spirit. Now, the third area that I want to look at is material need. Most of the most serious effects of the pandemic concern the capitalist economy, which regularly puts marginalized folks into precarious situations. Now, today I'm going to share some of these experiences, but I do want to make clear that this precariousness was not my personal situation. As Irina said, I'm employed at the University of Regina. I am so fortunate that I was able to work from home for most of this pandemic. But I do want to tell you about the groceries and the baking that I took to old ones, and the snow that I shoveled for others, and the visits. Folks were very, very lonely. I sent medicines of sweetgrass and sage to isolated people who had moved to new territories. This pandemic has had me think deeply about the ways we nourish body and spirit, especially when taken for granted things like access to grocery stores and medicine picking trips were curbed. So I'd like to suggest to you that the resiliency I have observed in light of the pandemic similarly reflects these three components to Indigenous identity. The first, relational responsibility and kinship. The second, cultural and spiritual identity. And the third, material needs. Now, I've abandoned my PowerPoint presentation, but I do want to share with you one slide. So bear with me while I pull this up using new technology, which is always fun. Okay, can we see this? Sorry, is that yes? Can we see a list?
You can, if you just close, because we can see everybody.
Okay.
You know, the speakers. If you can just pull up the PowerPoint, just minimize the other screen, then we'll be. Yeah, there we go. That's right.
Okay, perfect. Great. Thank you, Irina. Thank you. New technology, always a learning curve in this pandemic.
You did great.
Okay. So I'm sure I don't need to explain to folks the relationship between colonialism and socioeconomic inequalities that Indigenous peoples face. But I do want to share this list here of some of those broad impacts of COVID-19 that accentuate these kinds of inequalities. To put this into perspective, I want to borrow from James Frideris. Now, he has said that colonialism in general has 8 different phases. The provision of substandard social health services and economic viability are key determinants to any colonial project's success. So, disproportionate socioeconomic indicators are purposeful and even unavoidable tactics of colonial projects. In Canada, we know that many Indigenous communities face health concerns, food insecurity, lack clean water, and so on. That is to say, Indigenous peoples experience disproportionate negative socioeconomic impacts, as this slide here demonstrates. And according to Frideris, this is directly due to colonialism. Also, these impacts tend to be felt more acutely in northern versus southern regions and rural or reserve areas versus urban centers. Importantly, these circumstances left many communities disproportionately unprepared for the COVID-19 pandemic. For example, in some communities, frequent hand washing is a challenge due to a lack of running water or clean water. Physical distancing and self-isolation are impossible due to overcrowded housing. Healthcare access is not equitable across the country nor Indigenous communities. Throughout this pandemic, we've witnessed a widespread fear and disinformation concerning vaccines. For Indigenous communities, this is compounded by the legacies of colonialism. For example, some Indigenous peoples at residential schools were used as guinea pigs for various scientific tests, and researchers have misused Indigenous peoples' blood and DNA samples. Now, these are long-standing issues rooted in colonial inequities. They are made more prevalent and dangerous in the face of COVID, and they also act as dire warnings for this ongoing pandemic and future pandemics, which could lead to higher risks in the number of cases and deaths. More specifically, in Saskatchewan, it was disheartening to witness the disconnect in public health measures that allowed for restrictions to be applied and removed based on data of caseloads in southern regions and urban centers. These were often hit earlier with less severity and curtailed sooner than northern, rural, and reserve communities. As some of us might have heard in the evening news or read in newspapers, those leaders in these northern, rural, and reserve communities were often very vocal on this glaring oversight that ignored the health and safety of these communities. We'd be correct to align these oversights and this list here that I'm showing you with ongoing colonial disregard for these communities. More specifically, in Regina, I saw COVID pose life and death circumstances to community members. Regularly, folks had to decide between their personal safety and public transit or their workplaces. Our city watched as Camp Hope was set up, overdoses spiked. There was an uptake in use of food bank and homeless shelters. Drop-in centers attracted folks who put aside the risk of infection for food or other required supports. And I am sure in your own community, you witnessed similar hard decisions made. I'm sure as well that you also witnessed, as I did, creative responses to curb these socioeconomic results. And it's here in these responses to colonial enforced inequities, heightened by the pandemic, that I see lessons for reconciliation. So I'm just going to turn this off. We don't need to look at that list anymore. Okay, so I want to talk about some of these lessons for reconciliation. So let's return to those three aspects of Indigenous identity that I discussed earlier: relational responsibility and kinship, cultural identity, and material need. Now, I do want to note that these are not the only features of my Indigenous identity or anyone else's. That would be absolutely overly reductive. But I do want to share that I chose these to reflect my personal experience with the pandemic and to extrapolate general lessons for reconciliation. I chose these because they highlight the ways that colonization has for centuries attempted to erase Indigenous difference. So when we think about COVID, we might be able to understand how COVID highlights colonial inequities, how the pandemic reinforced these colonial inequities, and how responses to the pandemic provide insights into reconciliation. Now, of course, reconciliation means many different things, and I'm sure if we kind of did a poll of the audience members, we'd have all sorts of definitions of what this is. It might mean repairing relationships. It might mean healing from residential schools or their ongoing legacies. It might mean finding new ways to do things that ensure or promote equity in situations mired by colonial inequities. When I engage in reconciliation work, I ask, how are we situating Indigenous voices? How are Indigenous peoples leading program development? Does the decision-making table include a range of nations, languages, and territories that represent various perspectives? Returning to relational responsibility and kinship, I wonder, how are other Indigenous relations kept apart? What limitations has the pandemic put on others, and how has this impacted their own sense of and practices of kinship? When I think about reconciliation, I might ask, what are the policies that destroy families? How do we foster better contemporary child welfare practices, or judicial and penal systems? Or how do we ensure intergenerational learning on the land? When I think about cultural and spiritual identity, I saw many online resources grow: language classes, beading circles, knowledge keeper talks on cultural tradition. I certainly took advantage of many of these myself, but of course the online world presents a myriad of equity barriers for user take-up. Additionally, in these spaces, I saw folks rush protocols that should not be rushed. So when I think about reconciliation, I wonder, how are we repairing the harms of residential schools? Are we centering languages, knowledges, and cultures of the First Peoples in our programs? Can we work with funding guidelines to ensure the necessary time is provided to foster cultural connections? Can Indigenous voices lead in authentic ways? And then finally, material need. Andrew pointed out all sorts of firsthand experiences he had that I also shared around issues in our city around food insecurity. But like Andrew, I also saw how community came together in spontaneous ways. For example, food delivery programs, or, I used the COVID vaccine clinic set up with culturally supportive approaches within our community. When I think about reconciliation, I ask, what inequities exist as a result of the Indian Act? What legacies exist around housing and water insecurities? What barriers exist to healthcare and education? And how do these barriers foster racism? Now, throughout the colonial project that is Canada, Indigenous peoples have resisted assimilation and genocide. These questions that I pose today are based on those practices of resistance that I came to know throughout this pandemic. They ensure Indigenous voice and leadership. They ensure resources are responsive to both culture and past or contemporary colonial harms. These are acts of reconciliation. So in conclusion, I do imagine that this audience here today works across various sectors, and thus reconciliation will, and in fact should, look different. How might your organization ensure that Indigenous community members have decision-making abilities? How will they lead? Will the needs of Indigenous community be connected to the legacies of colonization? Will actions be rooted in practices of self-determination? Are you ensuring that your work does not foster colonial inequity? Now, I want to share one last slide in my conclusion, and I apologize for this not being as smooth as it could be. Here we go. Okay, so I want to share this slide. This is one approach that I have also come to know during the pandemic. It's called radical hope. And I think that this model of radical hope can connect really nicely to reconciliation. As you can see here, radical hope is something that grounds us in the middle between past and future. It supports the work that is both collective and individual. It's premised in collective memory and ancestral pride. In my mind, radical hope is certainly what Indigenous peoples have practiced in the face of colonialism since this project of Canada began, and it surely drives community response throughout this pandemic. It allows us to put reconciliation into practice. So with that, I say miigwech, marzi, thank you, and let me unshare my screen. Thank you.
Thank you. Excuse me. Thank you, Emily, so much. I have to say, I was deeply moved by your story about your son. It gave me goosebumps as you were describing that. And I think where it connects to is something that Miriam said in the beginning, and it was sort of this thread that went through Tracy's presentation and Andrew's presentation about capturing those lived experiences, those voices, Indigenous, non-Indigenous, refugee voices, others, in evidence-based decision making, into kind of well-being aspects that we are that are important to us, and they need to be taken into consideration. And so your presentation really ties this all together and kind of reminds us, as we are moving into the question and answer period, that those are crucial. And I thank you for reminding us, for highlighting that through your presentation, through sharing a story of your son. I'm deeply moved by that. Thank you. I also would like to extend a very heartfelt thank you to all our presenters today, to everybody who could attend and share your time. I know you probably could have been at different places today, but I really would like to thank you for coming to this presentation, for listening to stories that are being told, and again to the panelists for sharing your expertise, for sharing your perspectives, for giving us this enlightening experience. So we're ready to open the floor for questions, and I know we have English-speaking and French-speaking moderators who are going to navigate and help us through that. Thank you, Peter and Jean-Marc. And if we could just kindly remind you again to use the chat function for questions. And thank you again for today.
So we do have some questions from the audience. There was almost 75 persons attending up to now, so that's very interesting. The first question is from Floriane Lemoine, and it will be addressed, I think, to Myriam about her presentation with the idea of participatory grant making and the experience that you highlight. And the question is, you talk about a panel that was settled to do the participatory, and how were selected the people that participate in that panel. And a sub-question was, if they belong to community organization, will those organizations still be available to receive granting? Because there could be some kind of conflict of interest. And we can say that's a larger question. When you do have money that is administered by community, well, community, it means people from the community. So there's always interest conflict that could appear in the process. So those are the two first questions that we have.
Thank you very much, Florian, for these questions. Yeah, very practical questions as well, very interesting ones. We reach out to a very large diversity of actors in the PL community to recruit the People's Panels member. So it was an open call that went through grassroots organizations, volunteer centers, community centers, the municipality and other institutional partners as well helped us spread the invitation to take part in the People's Panel. And one thing I did not mention in the process, but that was very interesting, is that we held several coaching sessions or information sessions throughout the process, so that people from the community can just ask questions, but also contribute and bring input to the process. So in one of the sessions, we asked them, who should be on the People's Panel? Like, how should we select them? What criteria should we use, right? So that was very interesting, and I'm happy to share some of the tools that we have developed from that, like a very simple questionnaire that people had to answer, but we were looking for diversity in terms of men, women, age, diversity of experiences, diversity of ethnicity, cultural backgrounds, and so on. So we had 12 people at the end that were selected for the People's Panel from the criteria that were collectively defined. And I would say about half of them were leaders from the community with lived experience, but working in the immigrant serving sector or health-related sector. And half of them were people with lived experience, but that were not working in the sector at all, but that had faced themselves barriers in terms of employment or other employment-related issues. So this is how we selected them. And the other question was about conflict of interest. Yeah. So together we co-designed the application guidelines for the project that you saw on the slide. And then some of the organizations were interested in submitting a proposal. So we had a discussion with them, and the panel decided that it was conflict of interest, and that in terms of even if they were, because sometimes like we presume that people won't be able to look at the greater good of the community, right? And be able to select projects with very objective criteria as any other panel would do. But they were aware of the perception. So it was mostly the perception of conflict of interest that made them decide to ask these three organizations to step down, these three people to step down from the process, so that they could actually apply. So it was a restrained group of 9 people that made the final decisions on the project. So I don't know if I'm answering all of this there, but these are definitely interesting questions like to keep exploring and learning from.
Thanks, Miriam. Maybe we can
Okay.
jump a little bit because Andrew said that there could be an interest of having such a model, participatory model at the municipal level. And we can ask also Tracy, how does it feel from the community organization to go in that direction? Are there already organizations in Saskatchewan that are doing giving in the way of asking people to community members to participate in the decision making to allocate the resources?
So I can start in terms of an answer for that. There is certainly a growing awareness of participatory grant-making models, and I think a real interest in the part of organizations to examine how their respective organizations can embrace that model. This isn't, I think where many of us operate is not quite participatory, but where we are in fact relying on the knowledge and expertise of people from within certain regions to help in grant making decisions. So a model that we use that is commonly used by other funding organizations is we have volunteer peer review committees who, in our case, we organize that geographically, and where people who participate on those communities are actually people who live and work within those respective communities, so that when they are coming to the decision-making table, they have that awareness and knowledge of their own communities behind them, and awareness and knowledge of the organizations who are also applying. So we're not quite the 100% participatory model, but somewhere in between. And the way that we manage conflict of interest is because many of the people who sit at those committees are in fact organizations who may apply or have received funding from our organization. We do have a robust conflict of interest policy in place, and so they're not excluded from either applying for a grant or from continuing to sit on a committee, but we have a process that manages that so that if an individual has a conflict of interest with a particular application, they don't review that application. They don't even see it. They step out of the room when those applications are being discussed. So that's sort of our knowledge of that model of grant making.
I don't know if you want to go, Andrew, or can I add something very quickly? We talk about participatory grant making, but there's a whole spectrum of ways that participatory grant making can be implemented. And I just want to say, because I come from a funder's perspective, prior to joining Tamarack, I worked at United Way of Greater Montreal, and this is quite, I would say, a very audacious approach that the West Mariam SFA Fund took on completely ceding the whole funding. Like, they are not involved at all in any part of the decision. So to trust an intermediary organization like Tamarack, who doesn't have prior experience as a funder, who has expertise in community engagement, basically to be there to facilitate, to support the process. So they really step back. But there are many other models where you can have advisory boards, where you can have different kinds of consultations. As Tracy mentioned, these are great examples of like a consultation and also evidence-based, where you use that knowledge and that lived experience from the community in different ways. So I just want to mention that it's not a one-size-fits-all, that there's a whole spectrum of potentialities to explore how to make those processes more participatory, and also how to center it on lived experience in Indigenous communities as well. There are great examples in the West Coast where all the funding coming through certain communities have to go through the council of the example I'm referring to, the aunts that make the decisions for every dollar that is invested by philanthropy or even public institutions in terms of grants in their community. So these are all good examples.
Peter, I think you had some questions.
Yes, I think comments and questions, and some of the questions have been already addressed. But I think this one goes to Emily. I think it's a good one. It really speaks to how. I'll use the word sort of we. It's the question is coming from an Indigenous participant, but basically saying they're asking, how can we heal from the trauma of being put in a position as an essential worker, putting their own lives at risk and the lives of others at risk when it was required, and not being able to use their position as either an Indigenous person or as a minority to declaratively work remotely, that they in fact were forced into a position of working. So the question is, how can they move toward healing in that context?
Emily, your mic is shut down. You have to put your mic on.
Apologies for that. Sorry. Okay. So the question is, how do we heal from trauma of being put into a position as the essential worker? I want to go back to something I said in my presentation. I really recognize the privilege that I have of working in a university and working from home, which is a privilege that continues today, right? I can split my time at home as much as I want. So I really want to preface it that this isn't something that I'm personally working through, but I would, maybe draw from my experiences around being a political scientist and being extremely critical of capitalist frameworks, right? And that's what capitalism does. Capitalism requires workers to be put into very precarious situations. It always has. And so I want to sort of differentiate that while capitalism has been doing this for centuries, what we saw during the pandemic, and one of the panelists spoke to this, was the heightened precariousness in which marginalized folks experienced the pandemic because of the ways that capitalism structures our socioeconomic systems. So, how do we heal from this? It's a great question. I don't know that I necessarily know. I think that part of the question was around being an Indigenous person. And so as an Indigenous person, one of the things that is so sort of central to me mitigating modern day colonialism and the challenges that it poses to me as an individual is ceremony, returning to my roots. I'm going home for 2 weeks this summer, and I am on the land and seeing people. Now, whether or not that works for you in your particular situation, I can't say, but I do find that relational connection is so important to me overcoming personal trauma and strengthening my own Indigenous identity. So maybe I'll leave it there and open it to the panel if anybody else had any suggestions. Or moving on.
Yes. So there was another, not question, but maybe a need to have more information. On Miriam, you talk about a questionnaire and tools and a methodology to do the participatory. So where can we find those tools, elements of methodology that we can use? So that's one part. So it goes with your presentation. Will it be accessible? Can we get end of it? And Emily, the last slide that you show was on radical hope. So the image was very small, so it was very difficult to read inside. So one person asked, will it be possible to get the slides, or to have more, to have the information that could be accessible?
So, Emily, please, do you want to go? And thanks for sharing that radical hope, Emily. I've just become such a big fan.
Is there a way that I can share the citation with the audience?
Well, if yes, I don't know exactly directly. You can send it to yes, there's a way to send it. Maybe you can send it to my email, and I will send it to a person that can share it on the screen. So my email is fontan .jean/marc@commercial.ucam.ca. So it's a little bit too fast, maybe. So we will find a way.
Yeah,
we will find a way to share it.
Yeah, because I see we cannot share directly in the chat box as in other platforms, but I'm happy. In my presentation, there was a link to the participatory grant making page with like stories, also digital stories, and from the people's panel, and just general like tools, canvas, and resources about participatory grant making. So I'm very happy to share like anything that you might not find on the website, but there are tons of resources on community engagement throughout the Tamarack Library as well. So yeah, we'll send all of it to Jean-Marc. We'll overwhelm you with resources, Jean-Marc.
Thank you very much. So we have another question that asks, how is it possible for a community sector to demonstrate its social impact? So the question is really related to the way to do measurement, how to measure social impact in a community. I know it's a very large question, but I think we can find some elements to help design an answer. So anyone of you who would like to start answering that very large question?
Sure, I can take a shot at that. You're right, that is a huge question, and I think it's a question that many, if not all, organizations struggle with, for sure. Some of the models that are used are logic models, for example, where outcomes are defined for particular programs, and then data collected to demonstrate the ability to achieve those outcomes. There's theories of change. For a while, calculations of social return on investment was kind of a thing. I don't hear that so much anymore. But you're absolutely right. It's a huge question when you take from trying to articulate the outcomes within your own organization and for those people, and then to put it out there at a broader level. And one of the challenges is, at which point do the outcomes being achieved stop being achieved by virtue of the program, and then are actually being abetted, I guess, if you will, by other factors in that individual's life that may also be contributing to positive outcomes. So there's not really one particular answer or model to that. But that was a challenge that we were facing in terms of our own work here, where we could understand on a program by program basis, and then aggregate some of that data. But to be able to answer the questions about the broader good is where we look to the Saskatchewan Index of Wellbeing as one one tool to perhaps look at that. And it's not even necessarily that you can draw a direct line from your programming to seeing an improvement on a particular indicator, but hope that you are contributing in some way to progress there.
So thank you very much. I think it helps to gap. Yes, Peter?
Oh, I was just going to say, I've got I guess a comment. Jen posted a comment a little while ago about the fact that in the city of Saskatoon, employees were essentially seconded to the Saskatoon interagency response to COVID, basically showing a real alignment, but also the fact that there's flexibility. There's flexibility when, in fact, the situation demands it. And I'm wondering whether, Andrew can speak to the fact that this, because I think the concern of going back to that sort of siloed rigidity, sort of pre-COVID, didn't serve people as well then, and they're not going to serve them now. And whether there's a way in which that tension can be, well, I guess in a sense, first of all, called out, as it were, from a municipal point of view, and the extent to which you feel that, in fact, that's something that municipalities should be paying some serious attention to.
I would say, for starters, necessity forces us to change, and I think COVID did that very quickly. And I say this as someone who gets frustrated with these claims that there are very strict jurisdictional boundaries between levels of government, and municipalities shouldn't be dabbling in issues that are predominantly public health, or homelessness is seen as someone else's jurisdiction. A crisis demands a response, and all of a sudden things that were impossible, all of a sudden, wow, we can do this really quickly. And so I think maybe it's just a matter of treating more issues with the same level of urgency as COVID. For instance, more people in Regina died of overdoses. Why would we not deal with that with the same level of urgency, which means, you have an intersectoral approach. You have all three levels of government coming to bear upon a particular issue. We all have the kind of resources and expertise that is required of this particular crisis. Community organizations would necessarily be part of that. The warm weather strategy is an example. When the temperature drops to 30, 40 below, homelessness in this city is not an uncomfortable situation. You will die of it. And yet we all of a sudden responded by bringing to bear a bunch of resources that solved an issue in the short term. Camp Hope turned into a semi-permanent space where the hardest to house all of a sudden had a roof over their head, food to eat. It just worked. And so it demonstrated that, one, the silos aren't unnecessary, the jurisdictional boundaries are unnecessary. We treated something as a crisis, and all of a sudden you got a crisis level response. That's what we kind of have to do. And then for things that perhaps are more oriented around social determinism, in which there is a long process that we have to examine, and we still take the same approach, which is all three levels of government, and including civil society agencies, are part of that solution. And that demands just a breakdown of the artificial barriers that we've constructed.
So there is another comment that just popped up on the screen from Charles Eric, and he said that one method to do the measurement is through storytelling. That could be a way to speak about the impact, but mainly it's always something that is very difficult. So to the question of Olga, there's many little tools that can be used, but it's very, very difficult to have a perfect tool, to have the perfect perceptions of the social impact of organizations. So I do not have any more comments and questions on the French chat. I don't know if, Peter, you do have elements on your side?
No, I'm fine here too, thanks.
Perfect. So I'll leave the room to Irina and Lynn then.
Thank you, Jean-Marc. Excuse me. Thank you, Jean-Marc. And I'm passing the torch to my co-host, Lynn Gidlek. She will introduce our musician, and we'll be wrapping up the session. Again, I'd like to express how grateful I am to Emily and Miriam and Andrew and Tracy and our moderators, Jean-Marc and Peter, for being here today, but also to all of you who could come and share your time. This presentation, there's so many takeaways. Certainly, one can write a story from everybody's presentations, and I'm so grateful to have been part of this. So thank you.
Well, thank you, everybody, and I echo what Irina just said. Both Irina and I are a little bit under the weather today, and we're, not sure what this morning would bring. But wow, so many pearls of wisdom in all 4 presentations. That this session is going to be recorded and will be on the PhilLab website. So I know myself and others will likely want to look at it again in the future. So Miriam, Tamarack has almost legendary status within the nonprofit circles that I've had the privilege of being invited to be a part of. Your knowledge of community engagement is so vast. The work you and your teammates are doing to help communities mobilize and be more collaborative and sustainable is so important. I'm confident that many of the people that joined us today are really going to seriously look into your resources about participatory grant making. That to me is so exciting. Tracy, the audience only got a small glimpse of the passion you have for advancing the interests of the nonprofit sector in Saskatchewan. Thank you for your leadership and congratulations on receiving a grant with Irina from the Social Sciences and Humanities Research Council to continue the really important work you're doing on well-being. And Andrew, you're such a refreshing voice around the City of Regina Council table. I'm happy to report to anyone that's on this call today that and is not from Regina, that in the last election, citizens of Regina voted a number of other progressive councillors so that he's not the lone voice around that table anymore. And we're really starting to see some real change in Regina again, something I'm really excited about and hopeful for. And Emily, one of the University of Regina's newest faculty members, but has quickly become one of my favorites. Thank you for being so open and honest during your presentation. I still have a little tear in my eye when you related the story about your son and, saying, where did the songs go? Thank you for sharing your lessons and insights into reconciliations. And I look forward to taking you over coffee in the near future and learning more about the concept of radical hope.